So thank you and good afternoon, everyone, and welcome to my presentation. First of all, I would like to thank the organizing group for giving me such opportunity to be a part of this event. And again, I want to thank you for making it to my presentation. So as you see in the screen, I'm here in my presentation reporting the findings of an interesting study I conducted recently. And the title is The Predictors of Parenting Stress Among Mothers Raising Children with Autism Spectrum Disorders in the Sultanate of Oman. And in that, we explore and tested the mediating role of the self-compassion. So before we delve into the deeper in the study, I want to give you a background about why this study is important. So autism spectrum disorder has been one of the most significant challenges to the health system in the last 15 years. And the prevalence of autism is increasing worldwide. And it became a global trend. So it is international wise, not in a significant country. And the reason for that is not that there is a massive cases being discovered. No, it's because of the increase of the awareness about autism and the advanced diagnostic assessment. Okay, so this scenario is not different in my country, Oman, which is an Arab Muslim country in the west of Asia. The prevalence rate is increasing, and there is a burden on the Omani health system, medical health system. Okay, so now autism is more challenging when we bring it to the parenting context, because autism is a severe, complex, lifelong developmental disorders that are characterized with the social deficit and the communication impairment, and the repetitive behavior. So this complex condition create a challenge for mothers, parents who are raising children with autism. And now this study is not focusing on the experience of raising children with autism. It's focused on the parenting stress as a concept, and linking it to the autism field. Parenting stress as a concept is different than the usual or the general stress concept, because in parenting stress concept, the stress, it is a role-specific concept. So stress arises from you practicing the role of a mother or a father, okay, from the practicing or parenting practices itself. So this study is focusing on parenting stress within the autism field, and it's also explore the other factors that may come into interplay with the parenting stress. For example, self-compassion, coping, social support, parental burden, and the mental health. So this study proposed a predictive model for parenting stress, where we explore predictors, mediators, and moderators of parenting stress among, of course, mothers raising children, Omani mothers raising children with it, because the context is important for autism. So the aim of the study is to test whether anxiety, stress, depression, parental burden, and affiliate stigma predict parental stress among Omani mothers raising children with autism. It also tests whether parental self-compassion mediates the relationship of those predictive and the parenting stress itself. And then it tests whether the perceived social support and the coping strategy moderate the relationship between the parental stress and its potential predictors. And here I want to just delve a little bit in what is mediators and moderators. Okay, when we are examining social phenomena and contexts, we don't go for casual cause and effect relationship only, because it is a social context. So there must be a factors could mediate and moderate. Mediators are a third variable. Mediator is a third variable that link the cause with the effect. So it is in the middle, mediating the relationship between the cause and effect. But the moderators modify the relationship. It is in the middle, but it is not having the link. It have an ability to modify the relationship, either strengthen it, weaken it, or changing the direction. Okay, so the design of the study was cross-sectional design, and we recruited 100 Omani mothers raising children with ASD from 12 autism centers, along with the Autism Association, Oman Autism Association, in 6 regions in the Sultanate of Oman. And the results are, there were severe levels of parenting stress and anxiety, and a moderate levels of depression, affiliate stigma, social support, and self-compassion among those mothers. So parenting stress and affiliate stigma, social support, and self-compassion levels were expected, but one of these findings were unexpected, which is the affiliate stigma. When we say an affiliate stigma, is the feeling or internalizing the stigmatization because I am related to somebody who's having disability or having any kind of chronic diseases. So it's not me that having this disability, I'm relating to somebody who's having it. So I call it affiliate, it's called affiliate stigma. Affiliate stigma here was moderate in level. Usually, in the literature, it's this result does not unexpected, and it's interesting because it does not resonate with what is there in the literature. Usually literature is saying that affiliate stigma. So I was explaining something about the affiliate stigma when I said there are an expected result related to the affiliate stigma, where the mother were not having a severe affiliate stigma, though our society is a collective society, and we living in a large family, and we expect that society norms and the opinion of others will affect them, but it did not. And we give an example, like in number 15, having a child with autism makes me think that I am incomplete compared to other people. And the result, like 63% of the mothers disagree with that. And then I reduce the subscales of the affiliate stigma scale. Number 11, when they say, I reduce a contact with my friends and relatives because I have a child with autism. And then around, 38 agree, but still 33 disagree with that. And then we said that regarding the active coping, there were like the study revealed that there is an active coping to the experience of raising a child with autism, and that related to the focusing and the problem focus coping, and not the emotional focus coping. And then one of the important strategy that use the religious, and this is expected since they are Muslims, and Islam is a very strongly rooted in the Omani society, with it is a lifestyle rather than a religion only. So then we move to the predictors of parenting stress that we assessed, and we said that the study revealed that parental burden and stigma were significantly predictor for parenting stress. So whenever the mother scored high in the parental burden, it's expected that they will be having parental stress, high levels of parental stress. And again, for the stigma, for self-compassion as a factor that can mediate the relationship between predictor factors and parenting stress, the study revealed that self-compassion partially mediates this relationship, which means self-compassion is important in the relationship between, and significant in the relationship between, in linking the predictive factors and the parenting stress as an outcome. Then the moderation analysis of social support and the coping skills between the predictive factors and parenting stress. The result revealed a negative and significant moderation effect of problem-focused coping on the relationship between anxiety and parenting stress, as an example. So if there is a low utilization of the coping strategy, the relationship between the predictive factors and parenting stress will be strong. The more utilization or the less utilization of this, the relationship will be weakened. Means coping strategy is a positive thing in order to reduce parenting stress. But the more interesting things here is the social support. Social support did not moderate the relationship between the predictive factor and parenting stress, and this is needed more exploration, since in the collecting the study, it seems this social support was having 3 subscales: family, subfamily, significant others, and difference. And the study reveals that the most significant and important source of social support was the significant other. But even though this is as a construct, did not affect the relationship between the predictive factor and the parenting stress. So regarding the discussion and the implication, the mothers of children with ASD are at risk, increased risk for mental health concern. So, and this is a warning sign for all health care providers. The mother will come with her son or daughter having an autism, and the focus will be on the son and or the daughter, but also the mothers as an environment those children are living in should be taken care of, and especially in terms of their mental health, because it directly affects the children too. So, and it's also reflected the need for psychological intervention in here. Now, social support needs to be increased in terms of its awareness, and that community social support in terms of family, significant others, and community, and all health institutions has to take responsibility in this, because it seems to be really important and significant factors. And health and social development services has to be joined together to provide and improve the quality of life, both joined together. So in Oman, there is 2 entities responsible for the autism, like autism, let us say the individuals with autism and their families, which is the Ministry of Health and Ministry of Social Development. But there was no link in providing services to them. But this study reflects that there has to be a link between those 2 entities, and they have to work together, not only providing for the children with individuals with autism, but for their families too. And that's all. Thank you so much.